Okay, so my name is Cherie. I am an associate professor at the Diocano College of Pharmacy. We're located on the Big Island of Hawaii, or the Hawaii Island. I think it got renamed maybe to Hawaii. I don't remember. There was a renaming, but we're on the Big Island in Hilo. My office is actually on Oahu, and I practice out of Avena's Health, Castle Medical on the windward side of the island. I'm gonna go over today with you some updates on vaccinations and long COVID. Hopefully, it's not going to be too controversial. I'm going to address some of the elephants in the room early on, so I'll try to keep it a little bit lower on the temperature gauge. And by any means, please stop me for questions if you have any questions from here forward. I have nothing to disclose, and basically, my objective is to review vaccination status and recommendations for patients with long COVID, and discuss some of the updates on vaccination recommendations in general for long COVID patients, specifically adults. Kids are their own little world too, and they're a lot more specific. I can give you or send information if you want more on pediatric patients, but I'm focusing more on the adult um, population for this set of lecture series. Okay, so here's the elephant in the room. There's been a lot of development on the COVID vaccine front, basically from some updates in our federal government with the changing of panels for the CDC and ACIP. So the advisory panel shifted back last June. After that, there were some approval changes for one of the Moderna vaccines. So that only this Moderna COVID-19 vaccine was only approved for individuals 65 and older, and those 6 months to 64 years with underlying medical conditions. So the approval changed a little bit versus like it's approved for all these people. And then last September, there were new recommendations that came out. So those new recommendations changed a little bit. So it caused a lot of confusion for some prescribers because of the FDA indications. And they added this comment on shared clinical decision making. So what does that really mean? And that's very gray area. So a lot of prescribers and practitioners were very confused on whether to administer or recommend vaccinations for their patients or not. So right after that, new recommendation came out. The West Coast Health Alliance started to form, and I'll go over West Coast Health Alliance. And I figured it's relevant to this platform because we're trying to hit Asia Pacific, and the West Coast Health Alliance includes Hawaii and some of the West Coast, like Washington, California, Oregon. So West Coast Health Alliance came out, and I'll go over that. Then in September 23 for Hawaii, Governor Green actually made an emergency proclamation, and this proclamation ensured us that COVID vaccines would be accessible to all patients, and he wanted to make sure that it was available and readily available to our populations. That proclamation has been extended up to 3 times. This is the first extension here. It just passed January 17th, but on January 16th, he extended it again. And I'll go over that extension in a few slides. Let's see. Okay, so what is the West Coast Health Alliance? So it was formed back in September 2025. The goal was just to coordinate a lot of the health guidelines by aligning immunization recommendations with scientific literature. Some of the recommendations that were made to update back prior to West Coast Health Alliance forming, they failed to recognize new safety and efficacy data. And a lot of that recommendation wasn't aligned with data. So West Coast Health Alliance got put together, Washington, California, Oregon, and Hawaii, to assure that immunization recommendations align with informed, trusted scientific recommendations. So basically, it was there to promote science-based immunization guidance to make sure we provide access and provide reliable, non-political information to patients and providers to make the best recommendations for the best health outcomes. So what this alliance did was it expanded the eligibility. They got together and they pulled some of the resources, and I'll go over some of the recommendations in contrast to the ACIP recommendations. And you'll see a little bit of a difference. West Coast Health Alliance made a little bit broader and a lot less confusing than the updated recommendations by CDC and ACIP. So overall, they expanded availability or eligibility of vaccines and approved uses for children aged 2 months to 23 months, individuals who are at high risk or in close contact to high risk patients, anyone younger than 65 who want to get protection, and those ages 65 and older, especially those who are at high risk with underlying conditions. So here in Hawaii, the vaccine response or vaccination response was through this emergency proclamation that Governor Green just had initiated in September. Since then, he's renewed it in November, and he's just renewed it on the 16th to go through March 17th, and we will be updating. He'll be updating those renewals as we go. So basically, what this emergency proclamation does is it allows allows the vaccine to be readily available and accessible to our population to decrease the incidence and reduce the burden of vaccine preventable diseases. And it ensures public health and safety. And he acknowledged pharmacists as important providers or people that can provide immunizations to patients throughout our state. Okay, so now we're going to move in. So we've gone through the elephant in the room and what we've been doing in Hawaii and the West Coast Health Alliance. Moving on to risk factors and who should actually be getting the vaccine based on ACIP recommendations and the CDC versus what the West Coast Health Alliance is recommending. So the demographic factors are going to be different. You can see the CDC and ACIP have a little bit more limited demographic factors, whereas literature used to support healthcare providers, residents of long-term care facilities, household contacts, high-risk patients, and the younger unvaccinated patients. So it kind of encompassed almost everybody. ACIP, with this new update, they stratified risk categories based on their research or literature that they looked at. And they looked at high risk, suggestive risk, and inconclusive risk, and which to me is very, very confusing, where they only recommend it for these high-risk populations, which is this long list of populations with separate subcategories under each of these disabilities. So it's not very specific as to which disabilities they're talking about. There's an exhaustive list. So it's like, does my patient fall on that list? And it takes a long time to figure out what is the recommendation. Whereas it's very clear cut and says with West Coast Health Alliance literature, supported by literature, that these are the high risk patients, and they just put risk as risk. It's not high risk, it's just you are at risk with these types of comorbidities. Okay. Okay, so what does the literature say about patients with long COVID? Okay, so with long COVID, we are looking at effectiveness and trying to figure out if patients who have long COVID, is it useful for them to get vaccinated as well or to continue to get vaccinated? Overall, there's been a lot of studies looking at vaccine usage and the effect on long COVID symptoms. This is a meta-analysis. Some of the studies I pulled were all the systematic reviews and meta-analysis because there's so much literature out there saying different things, and these pull all of the information together for us to get a bigger population size. And these are some of the more updated ones with literature saying that vaccine is pretty much supporting that it decreases long COVID or post-COVID conditions. So this is a study by Pine and colleagues. It included a bunch of non-randomized studies, 65. It's a pretty robust meta-analysis with over 5 million people in there. They looked at vaccine efficacy and effectiveness of the vaccine prior to infection and preventing post-COVID conditions or long COVID. So they have these two definitions of post-COVID condition, which is the continued or development of new symptoms that were assessed 3 months after initial infection. And then you have long COVID, which is the continued development of new symptoms 4 weeks after infection. And then they also looked at time to reconvalescence and symptoms like that affect daily activity or quality of life. So generally speaking, this study found that vaccine effectiveness was seen for anybody that had one or more doses. So statistically significant, showing that vaccine is effective, irrespective of, it looked at the vaccine irrespective of timing. So the next study I'm going over is going to look at timing of infection and vaccine. This is just looking at vaccine use and post-COVID conditions.
And I'm just going to step in right here, and you might cover this later, but we have a question on the chat saying, are there recommendations referring to first-time vax or boosters or both?
Yes, I'll go over some of the schedules. Let me read this. Boosters. I'll go over vaccine schedule a little bit later. The recommendations are just, it comes out yearly. So the yearly 25 to 26 recommendations are going to come out, and then they update those. They've been updating them. So we have one just for 25-26 year. I anticipate them coming out with another recommendation for next year. But right now, the recommendations are the ones I gave you as far as like, if you're unvaccinated, you should get vaccinated. I hope that answered your question. Okay. Let's see. Moving on. The next study shows that I included this because it looks at the effect of the vaccine pre and post-COVID vaccination, or the vaccination on whether or not you got it pre-COVID or after you've already been infected with COVID before. So it included a lot of 25 observational studies. They did not include randomized control trials because randomized control trials are very hard to do, especially with vaccinations and specifically for COVID in general. We have a lot of observational and historical data that we can look and pull up. The objective was basically to look at the effect of pre-COVID and post-COVID vaccination on long COVID. And they used the World Health Organization definition of long COVID, which was symptoms persisting greater than 3 months. And they standardized that definition for this specific study. So they looked at long COVID symptoms and the incidence. Basically, this study had a ton of different things that it looked at, but overall, it found that if you had 2 doses pre-infection, you had a lower odds of long COVID. The data for 1 dose versus 3 doses is non-significant. It is still non-significant, but that is because all of the different studies included in this meta-analysis had different variations in odds ratios. So it pulls the study in 2 different ways. So they need more specific data to actually prove or show significance for 1 dose versus 3 dose, but it did show significance for 2 dose. The data does show that it could potentially show it is likely to show significance for 3 doses and more afterwards, but more studies need to be included and assessed for that as well. Okay, some of the other issues that you have to think about with post-COVID and vaccination and what type of vaccine you're giving. With these studies, the caveats are that we have different variants that people were infected with, which does play a role, and the different types of vaccines. So the literature is back and forth, um, but most of it overwhelmingly pulls to benefit of vaccination, especially with COVID-19 and continuing to vaccinate annually to prevent long COVID or post-COVID syndromes. Okay, because this is on vaccines and most COVID and long COVID patients are fit the mold of, they have upper respiratory issues and they could potentially be infected with other upper respiratory viruses that are running rampant right now. I included a little bit of literature on influenza and RSV, which are some other hot topics, but I just put a little bit in there to be complete about the upper respiratory virus category and vaccine recommendations. This is some of the recommendations by the West Coast Health Alliance. To me, this is the clearest one. It's nice picture, color coded, very clear and to the point. Basically, everybody should get a flu shot. Anybody at risk, the very, very young and the very old should get an RSV vaccination, COVID vaccine, anybody who wants one, and all those over the age of 65. So vaccine recommendations, I'll go over some of the vaccines a little bit more on the COVID-19 front to tell you which ones are which. But for the most part, this is the side-by-side recommendations for West Coast Health Alliance in contrast with the CDC and the ACIP. West Coast Health Alliance says, yes, all patients over 65 and older, especially those with risk factors that are younger than 65, and anybody who wants a vaccine or in close contacts with others. And then CDC ACIP gives high risk, suggestive risk. It's based on individual decision making, which is again a gray area. Pregnancy, it recommends all who are planning, pregnant, postpartum, or lactating, whereas CDC, ACIP didn't really have a recommendation on the pregnancy front for COVID vaccinations. For flu, there are various different flu vaccines out there. You have inactivated influenza, the trivalent forms, you have the recombinant trivalent forms, the RIV3, and then you have the live attenuated vaccine, which is usually the nasal spray. Those are recommended for everybody. In pregnancy, just remember, you can only give the inactivated vaccines. You cannot give them live attenuated vaccine. For RSV is recommended usually in the September to January timeframe, but in Hawaii or the Pacific, sometimes the timing of these upper respiratory viruses delayed or is different from mainland United States. So there is a caveat that it's better to get it during these times, but if you live in certain climates in certain areas, you can get it outside of that September to January window. But for RSV, it's recommended that all pregnant people or all pregnant women should get it. They should only be getting this Brazil only vaccine. This is the only one approved for pregnant females. And then for adults, generally speaking, 75 years or older, or all adults 50 years or older with risk factors. So more specifics on the COVID-19 vaccines. There's 4 different vaccines out there. We have Moderna, which is either the Spikevax or the MNX Spikevax. So it differs based on the age of the patient. So you can use the Spikevax for the younger patient population, whereas the NX Spike, you have to use it for the 12 years or older population. And then you have the Pfizer-BioNTech vaccine, and then you have a non-mRNA vaccine, which is the Novavax. It is a protein subunit type of vaccine, and that's only for 12 years or older. The recommendations for vaccine schedule and how to go about determining if you should get the vaccine and how many you need. I only highlighted the adults for now. There's a little bit more recommendations, and this is based on Department of Health and recommendations for the state of Hawaii. And these are based off of West Coast Health Alliance as well, too. So for COVID-19 vaccine, if you're unvaccinated, you at least need a 2-dose series with 6 months between the first and the second dose. If you've had any vaccination prior to that, you can get, and you're less than 65 years of age, you get 1 annual dose usually. If you are 65 years or older, you need 2 doses, and that needs to be separated by 6 months. So it's a 2-dose series for 65 and older. So I think you could think of it as like you'll get every 6 months, you'll try to get a COVID-19 vaccine in that patient population. And lastly, for those who are severely immunocompromised, I just added this in here for completeness. You can just focus on this 12 plus for the adults. Basically, what it's saying, you need to add on 2 doses. Regardless if you're unvaccinated or not, you're going to need at least 2 to 3 doses. And it really depends on what your initial dose or vaccine was. So depending on the vaccine, you either will get a 2 or 3 dose series for COVID-19 vaccination. And it stratifies the doses or the vaccine here on the left. Okay. And that's all I have as far as updates, vaccine schedules, the literature. So overall, literature supports getting the vaccine. It decreases the occurrence of long COVID and post-COVID conditions, generally speaking. And I do recommend vaccines to prevent debilitating diseases.
Okay, so it looks like we got a question here. Do you want to read it yourself or do you want me to read it?
Let me
Oh,
see.
I could,
Oh, Dr.
I
Chow.
could. So, thank you for providing us with this interesting topic. I have several topics that you touched upon. So, I guess for the first question is that are there any differences in terms of the types of vaccinations for long COVID? So, some investigators have talked about Novavax versus mRNA type vaccines, and could you do you think that there might be any benefit to providing Novavax in terms of long COVID compared to mRNA?
I don't know that I've seen the differences in recommendations. It doesn't say one or over the other. And from a clinical pharmacy standpoint, some places don't carry specific vaccines, and one place will carry one specific vaccine. So to try and hunt down one vaccine just to get it, I feel like, personally speaking, I'd rather get a vaccine now when I can, versus wait for one that is maybe, I got to order it and wait in line 3 months from now. That's just the real life part of it, is the orderability and the availability of that vaccine on hand. If possible, and I don't know the literature, I haven't looked deep enough into the literature one over the other. I can try to look that up for you and figure that out, and I'll let you know. But I don't know that there is one over the other. I just think at this point, we're just trying to get vaccine to people.
Yeah. It's hard to get the Novavax too, primarily because of the stringent guidelines of Novavax, and I don't think they've been keeping up with each of the serotypes. The issue, I think, is there's been some concerns about some adults getting mRNA. So there's a I tend not to be I try to be a scientist with regards to vaccine, and there's always potential harms. As we know, mRNA vaccinations have been shown to show very small links towards like carditis with early vaccines, and so there's always a question, could COVID vaccinations cause long COVID primarily because of the issue of the spike protein? And I think it's still ongoing. My overall sense is that it's probably unlikely to do it, but as a scientist and trying to figure out, I do know that the national NIH Recover has been looking specifically in a smaller cohort of people
Mhm.
of could this potentially occur? I don't know. Do you have any any I
Um,
mean come
some
across
of the
that?
literature I looked at says that development of the proteins against that spike um, variant is beneficial. So it helps with the inflammatory response and creating that augmenting the inflammatory response that could potentially lead to long COVID symptoms or reconvalescence of disease. So I feel like it might go back and forth for a little while until we can figure out and I don't know that we will have the best vaccine at any one point in time just due to mutation of the virus itself. Um, I feel it's almost like the flu vaccine where we are going to have to recreate the wheel every time it starts to create a new variant. Um, it's
Yeah.
To me, it's still gray, and I'm still with you in that box. Like, which one is the best?
Yeah, clearly, I think mRNA technology is really has spurred a lot of new developments and even
Hmm.
into defense against certain types of cancers, right? So in cancer therapy, even HIV therapy, mRNA technology has been spurred, but so far no breakthroughs in terms of specific entities like HIV. But I think this type of technology previously wasn't really thought that it would work. But
Hmm.
then long COVID came along, and we found that the technology was available and was sped up rather quickly to develop effective vaccines. So one of my clients often ask me if one is good, and I think there was a follow-up comment of vaccines. Do you think giving double dosing or multiple dosing of mRNA would that like overcome any potential viral persistence? And do you think that that would be at all beneficial? Because immunologically, it
Hmm.
sounds like maybe perhaps a good idea to vaccinate every 2, 3 months to
Hmm.
try to keep your immune system impenetrable for
Hmm.
viral persistence. What do you think about that?
I feel like you're almost giving me some loaded questions here. Um, so the whole part about the every 2 to 3 months, um, you do need that little time to develop the immunity though. So some of the recommendations, I think looking back, it's a 6 months in between in order to start the development of those antibodies. Um, and with any vaccination, like there are recommendations, you have to space it apart. And if you don't space it apart, like you're still going to have issues. And those are the recommendations, right? You're not going to develop that full immunity before you get the next dose. Um, I don't know that more is better right now. And I don't know how fast we can develop vaccine to keep up with a every 2 to 3 month vaccination schedule. Um, I'm going to keep it at that to be politically
No, no,
correct.
no, no, yeah, yeah, no, I agree, I agree. Yeah, because we always, I think we always talk about like vaccinations for B cell and T cell. So
Mhm.
I think majority of the population has been vaccinated. I think the T cell response is probably going to keep you out the ICU, but the B cell response has been
Mhm.
somewhat shortened, so it only lasts for 3, 4 months, which we see in the community that the immunity laxes and falls. But that won't keep you from catching
Mhm.
COVID, but at least the T cell response, which seems permanent, will keep you out of the ICU. So,
Hmm.
yeah.
Yeah.
And I just before I could bring it to the next comment. Thanks for reminding us about both the RSV and influenza recommendations, especially this year that we've had a rather rough influenza epidemic. And I know people always are talking about how ineffective perhaps this year's influenza
Hmm.
vaccine was. It's still overall important to get flu vaccinations. They prior to COVID, flu deaths was quite high, and anything to help reduce um, uh, uh, deaths through
Hmm.
uh, associations of, of flu, it would be important. I just read and I liked how you wrote the RSV because the JAMA networks that they came out with a paper just like 2 weeks ago that showed
Mm.
that the RSV vaccinations really for the country of Denmark had dramatically reduced those who got the RSV vaccine
Hmm.
from compared to people who didn't, and it was substantially much lower. And the numbers needed to treat, they wrote in the paper, is 1 out of 20. And so, wow, that was profound in terms of the numbers needed to treat to prevent just one death from RSV. So thanks for reminding us about the importance of other vaccines such as RSV. Um,
I had
so
to too.
yeah. So I'll bring it back to Melissa for the next comments.
Okay, so it looks like we've got one comment on here that says the prior recommendations also said that the benefits outweigh the risks regarding mixing, i.e. the mRNA or Novavax or
Mhm.
Pfizer versus Moderna.
Yes, thanks, Lee, for bringing that up. It doesn't matter to stick with one vaccine. As long as you can get one, as it's a vaccine, get it because there's way more benefits. Just like with the flu vaccine, I think the numbers are about 20% effective, but that's 20% of efficacy you did not have prior to getting it. So those are things that you could potentially tell your patients as well,
Yeah,
regardless of.
and we also mentioned vaccines are designed to prevent hospitalization and death, not reduce contracting the disease.
Yes, same thing. So reducing ICU admissions for COVID with
Yeah.
vaccination, like that still outweighs the benefit. And I've seen those patients one firsthand. It's
Okay.
not fun.
All right. And then we have another question that says, for adults who were vaccinated as previously recommended with 2 doses of Moderna, less than 6 months separation, is another booster recommended?
I think wait, timing in my head, I have to see it visually sometimes. So let me think about this. Um, Recommended with 2 doses, less than six, the booster recommended. I think you would just once that last booster, you would just fall back on the booster schedule. I think I have to relook at that recommendation itself, but I think I can get back to you on that, especially with the Moderna. I think it would fine print for that one.
Okay. All right. Okay. Well, wonderful. Let's see. Does anybody else have any questions for us today? All right. If not, we'll go ahead and give everybody back a little bit of their day. Thank you, Dr. Chu, for presenting for us today. We appreciate it. And to all those attending, I just want to remind you that these slides are available on the ECHO website right now if you want to reference back to them. And then the recording will be there in a little bit. So, and then just a reminder, our next session is on February 10th. And the topic that day will be biomarkers in long COVID. So we hope to see you there. Have a good day.